The challenge with stroke care is the sheer magnitude of the problem. Stroke affects millions of Americans every year. It's among the leading causes of disability and death. And the costs to our healthcare system are staggering, over $30 billion a year. But secondly, and more troubling, is there's such a wide variation in the level or options of stroke care given to patients. The different ways that stroke can be treated depends on what community you're in, what part of the country, access to academic medical centers versus your local community hospital. From hospital to hospital, you may not get the same outcome. So what's working in stroke is that public awareness is increasing. More people are recognizing the signs and symptoms of stroke and getting to the nearest acute care facility, which essentially is decreasing the time from onset to treatment. Additionally, there are more and more certified stroke programs emerging. So the idea of coming together and creating a program that is in accordance with the Brain Attack Coalition and the Joint Commission, for example, to have a common approach and quality outcomes for how stroke care is given within the institution. And lastly, the technology has improved tremendously. From imaging to telemedicine, the options for diagnosis, treatment, and collaboration have improved. Individual stroke centers' efforts are admirable, but there are not enough of them to go around and support the provisioning of advanced stroke care on a broad enough level. The industry identified the solution to the problem over a decade ago, which was the formation of what's called a stroke system of care. It's the idea of organizing optimized resources across the entire spectrum from pre-hospital prevention through the acute phase and onto rehabilitation. And all of these resources coming together in a framework that gets the right treatment for the right patient in the right amount of time. Stroke is a growing problem that, without the quick formulation and maturity of these systems of care, so that whether you are in Boise, Idaho, or in Los Angeles, California, or Austin, Texas, that the treatment options and decisions that are made are consistent across not only your network, but other networks. That's the ideal future state for where stroke care needs to get to.